the unthinkable has happened. In a heart-wrenching turn of events, a young child in Texas has succumbed to measles. This marks the first measles-related death in the United States since 2015, a grim reminder of the disease's potential for devastation. The child of school-going age was admitted to a hospital in Lubbock, but sadly could not be saved. This tragic incident is a stark wake-up call, forcing us to confront the consequences of declining vaccination rates and the very real dangers of this highly contagious disease. While the measles vaccine has been hailed as a triumph of modern medicine, effectively controlling the spread of this once deadly disease for decades, the recent death in Texas serves as a painful reminder that the fight against measles is far from over. This tragedy underscores the importance of widespread vaccination as the most effective way to protect our communities, particularly the most vulnerable among us. The loss of this young life should serve as a poignant reminder of the importance of vaccination and the urgent need for accurate information to combat vaccine hesitancy. This recent fatality is not an isolated incident. It is part of a larger outbreak that has gripped parts of Texas and New Mexico, with over 130 cases reported, mostly among unvaccinated children. This outbreak has overwhelmed medical facilities, leading to the hospitalization of approximately 20 children in Texas alone. The epicenter of this outbreak lies in Gaines County, Texas, home to a significant Mennonite community. This community has been identified as having lower vaccination rates, highlighting the link between vaccine hesitancy and the resurgence of preventable diseases. The situation is further exacerbated by laws in Texas that allow for vaccine exemptions based on religious reasons, creating pockets of vulnerability within the population. These exemptions, while intended to respect individual beliefs, can inadvertently jeopardize public health, particularly in communities with high concentrations of unvaccinated individuals. The outbreak in Texas and New Mexico serves as a stark illustration of how quickly diseases like measles can spread within undervaccinated communities, putting countless lives at risk. Adding fuel to the fire is the spread of misinformation and the downplaying of the outbreak's severity by certain public figures. Notably, Health Secretary Robert F. Kennedy Jr. made misleading statements, incorrectly citing 2 deaths and claiming that such outbreaks are a regular occurrence. This kind of misinformation can be exceedingly dangerous, especially when coming from influential figures. It sows seeds of doubt and confusion, making it even more challenging to combat vaccine hesitancy and ensure that people have access to accurate science-backed information. The spread of misinformation and the downplaying of the situation only exacerbate an already critical situation. It underscores the importance of relying on credible sources of information, such as public health organizations and medical professionals, to make informed decisions about vaccinations. The recent outbreak and the tragic loss of life underscore a worrying trend: declining vaccination rates and the weakening of herd immunity. Data reveals a concerning drop in kindergarten vaccination rates from 95.2% in 2019 to 2020 to 92.7% in 2023 to 2024. This translates to roughly 280,000 vulnerable children who are not adequately protected against measles. Herd immunity, the concept that a sufficiently high percentage of vaccinated individuals can protect even the unvaccinated by disrupting disease transmission, relies on widespread vaccination coverage. However, the current vaccination rates fall short of the 95% threshold recommended by the CDC for measles. This decline in vaccination rates, fueled by misinformation and vaccine hesitancy, poses a significant threat to public health. As herd immunity wanes, we become more susceptible to outbreaks of preventable diseases like measles, jeopardizing the health and well-being of our communities.